Now coming to the third case. So this case, he came to us from Canada, and this boy is around 28, 29, and some 6-7 years ago he got hairline lowering there in Canada, and again, I don't know like what kind of procedure he got it done. It was looking, the hair on the front was crisscross. Some hair are going in this direction, some hair are going in that direction. If you look at them closely, it was very, very bizarre. And again, as I said, they get to know that very soon, and they get that consciousness, and they start saving them, keep them saved, and maintain that angle, so that and the unruly hair, they keep saving them. So she used to do that, and that becomes very catastrophic to these kind of people. They feel like, my God, it is the most horrible thing. Their attention goes there day in, day out, and they become very kind of shy, introvert. They don't talk to people, they don't like to meet people, because they have to do a lot of things to hide that, and that ultimately affects their performances in the profession and the social outings. So he came to us, and it is very difficult to make them understand that these hair needs to be extracted, and they get scared that the extraction sites will be having scars and they will look very bad. And though we have a lot of experience, but we cannot giving guarantee that these scars won't be kind of revealing, because ultimately when you put a needle to extract them, there could be potentially a scar. Like so far in our hands, they don't become apparent. Nobody can make out unless you really go close and try to spread the screen and look it on a microscope. Technically there will be a scar anyway. They don't, like, to the naked eyes, they don't look like any scar. So this boy was also a little bit skeptical. So we did it. We gave him all the information and all the potential scarring chance. Then after 6-7 months, you can see the outcome. Extremely happy, great outcome. He has a new angle and a new hairline, which is going with his flow of his hair, and he's happy. And of course, like as I told you, like we have been doing it almost on a daily basis, so we have mastered this, how to do it. But I have got a very heavy heart when I get this kind of patients and I have to do them. So I pray that they don't happen and I don't do them in future. Now the last case, that is the fourth case for today, and this person is around 40-41, and he was aspiring to be an actor, and so he went ahead for a hair restoration procedure. And if you see it on the screen, that you'll see that this hairline was very girlish. It was flared up, and the angle was blunted, and here the highlight was he got the temple done. The temple was done, and when he came, and then of course he understood very soon that everything has gone very, very bad for him. And when he came to us, when we examined him, we saw that the temple area contains very thick, dark, stucky hair, and behind the planted hair of the temple, there is the halo of baldness has started, and he's balding behind. So that was the most kind of unaesthetic thing that could happen, and of course his dream of becoming an actor was shattered. So he came to us, and we designed what to be done, and what would have been appropriate to his face, and what would be kind of potentially appropriate for his face in the future when he'll be like 50, 60 and all. So he agreed to that, and he had the confidence in our hands that we have been doing it. And there are so many examples to show to him, like his case. And of course he has, the one issue was that he has pigmented skin, little bit of kind of the darker shade, and the chances of post-inflammatory hyperpigmentation is a little bit more when you have a little bit of brownish pigment. So we went ahead, we extracted the hair from the angle as well as everything from the temple. So that was the major thing, extracting all the hair from the temple and giving a new hairline and frontotemporal angle and the temple. So that was, the temple was very, very crucial. And of course, like he was pressing to do a very aggressive temple. I said, no, it should not be, because you are balding behind the temporal area just above the ear, that means the chance that you will become further bald in this side. So don't become greedy for a very aggressive temple. You want to be an actor, be on the stage, you need to have a very good look in the temples and the hairline and all, but practical in terms of what is going to happen to the future prospective baldness. So it was all cool. He understood that it was very difficult, but he understood all the points. We came to the same page and we did that, and you can see now it is like some 1 week back we did that. You can see how we went ahead with the plan, and I'll be updating you about the outcome of this maybe after 6-7 months. I'm very confident that the way we have achieved outcomes in other patients, we will also achieve similar kind of results in this patient as well. And yeah, that's it for so these 4 cases I had discussed. And with this I just wanted to tell that please do it once and do it right. Do a lot of research, go to a lot of forums, meet a lot of doctors, meet a lot of patients, old patients, and then you will understand what are the things to expect from a hair transplantation. That is, you need to have a patients, like they expect a natural hairline, they want a dense and full coverage of the bald area, and they want to have hair forever. So these are like, if you summarize the expectation of the patient, then these are the 3 things. I can repeat it again: natural hairline, dense and complete coverage, and hair forever. So these questions will be answered, or these answers will be given to the patients by experts, veterans who have been doing it day in day out, who have got experience over thousands of cases under their belt, and who have produced great and amazing results to patients like you in past. So if you find these kind of things in some clinic with some doctor, then probably he should be your surgeon. You should go to him. Otherwise, don't jump into the price sensitive things, like which cheapest, go there, and after, I'm not going to discuss about the cost thing here, but try to go to people who have really done great work in past. So do it once, do it right. Thank you.
Are Dr. Pradeep Sethi and Dr. Arika Bansal. And the clinic is Eugenix Hair Sciences in India.